Ladies over 50, before your next blood test, pause for a moment. There are 10 mistakes that can ruin your results, delay your diagnosis, and even send your doctor down the wrong path. I've seen it happen time and time again, smart women making preventable errors only to be told something frightening that wasn't even real. And for women over 50, these mistakes aren't just numbers on a lab sheet, they can carry serious consequences. If your test shows falsely high glucose or cholesterol because you didn't fast correctly, your doctor may believe you're at risk for diabetes or heart disease. That could mean extra medications, repeat testing, or lifestyle changes you don't actually need. On the flip side, fasting too long can leave you lightheaded, lower your blood pressure, or even cause fainting. Clinical studies also show that extended fasting may temporarily alter kidney and electrolyte levels, sparking needless worry about kidney disease or other metabolic issues. At midlife and beyond, your body is more sensitive to stress, dehydration, and hormonal shifts. One inaccurate result can set off weeks of anxiety, follow-up visits, and sometimes even the wrong treatment. That's why avoiding these mistakes matters not just for accurate results, but for safeguarding your health and peace of mind. So, stay tuned. This is Health Mastery 365. Today we're walking through the most common mistakes women over 50 make before their blood work. And number 9, even some nurses don't know about it. If you've ever been puzzled by a blood test result, don't forget to like, comment, and subscribe. Now let's dive in. Mistake number 1, forgetting to fast or fasting far too long. This is by far one of the most common mistakes I encounter, especially among women over 50, who are balancing doctor's appointments, daily medications, and family responsibilities. So why does it matter so much? Because certain blood tests, like those measuring blood glucose, triglycerides, or cholesterol, depend entirely on fasting for accurate results. Fasting usually means no food and no drinks other than plain water for about 8 to 12 hours before your test. Sounds simple, right? Yet this is where many slip up. Some forget and grab a quick slice of toast or sip coffee with milk. Suddenly, their results are skewed. The doctor sees high blood sugar or elevated triglycerides and may mistakenly diagnose diabetes or even prescribe unnecessary medication. On the other hand, some women go too far, fasting 14 to 16 hours, believing that more is better. But extreme fasting can backfire. It stresses your body, raises cortisol, the stress hormone lowers blood pressure, and leaves you lightheaded when the nurse tries to draw blood. Research in clinical journals also shows that prolonged fasting may temporarily alter kidney function and electrolyte levels, creating results that don't reflect your true health. So what's the right balance? Always confirm with your physician if fasting is required for your specific tests. If it is, aim for that sweet spot, 8 to 12 hours. And remember, water only. Even black coffee or tea can interfere with lipid and glucose readings, especially once milk or sweeteners are added. Keep it simple, keep it clean, and your results will give your doctor the clearest picture of your health. Mistake number 2, taking medications or supplements that interfere with your results. This one is tricky, and it's not your fault. Many doctors forget to mention it, and many patients don't think to ask. But did you know that some of the most common medications and even everyday supplements can distort your blood test results? Take biotin, for example. It's widely used in hair, skin, and nail supplements. It seems completely harmless, right? Yet clinical studies published in the New England Journal of Medicine have shown that biotin can interfere with thyroid hormone testing, making it look as though you have hypothyroidism, or that your current thyroid medication dose is wrong, when in reality, everything is fine. And biotin isn't the only culprit. Anti-inflammatory drugs like ibuprofen may alter kidney function markers. Steroids can push your blood sugar higher and raise white blood cell counts. Diuretics, often called water tablets, can disrupt key electrolytes such as potassium and sodium, sometimes leading to results that look alarming. Even something as simple as vitamin D, if taken right before your test, can cause calcium levels to appear falsely elevated. The problem is that many women don't think of vitamins or herbal remedies as medications, but your body doesn't know the difference. Everything you take in changes your internal chemistry, whether it comes in a prescription bottle, a supplement jar, or a cup of herbal tea. So what's the best approach? Be transparent. Tell your doctor and the lab technician everything you're taking: prescriptions, over-the-counter drugs, vitamins, supplements, teas, powders, oils, even essential oils you consume. In some cases, your physician may recommend stopping certain supplements 24 to 72 hours before testing. But don't guess on your own. Always ask first. It's a simple step that can make the difference between an accurate diagnosis and a misleading one. Mistake number 3, not drinking enough water. Picture this: you arrive for your blood test early in the morning. It's been 10 hours since you last ate or drank anything. The nurse ties the band around your arm, but she can't find a vein. She tries the other arm. She pats your hand, warms your skin, still nothing. Why? Because you're dehydrated. Older women in particular are more prone to mild dehydration. Even if you don't feel thirsty, aging naturally blunts the body's thirst signals, and over time skin and veins lose some of their elasticity. That combination makes it harder for the phlebotomist to draw blood. And more importantly, it can throw off your results. When you're dehydrated, your blood becomes more concentrated. This can cause your hemoglobin, hematocrit, and electrolytes to appear falsely elevated. Clinical studies have also shown that kidney function tests like creatinine and BUN may look worse than they really are, simply because the body doesn't have enough fluid. Fortunately, the solution is simple. Unless your doctor has specifically told you otherwise, which is rare, you should drink 1 to 2 glasses of plain water about an hour before your test. Not too much, because you don't want to overload your bladder, but just enough to rehydrate your system and make your veins easier to find. And remember, water only, not juice, not coffee, not tea, just clean, plain water. 4. Exercising too strenuously the day before. I always encourage my senior patients to stay. Active movement is essential for healthy aging. But here's what I don't want: a heavy weightlifting session the day before your blood test. Why? Because intense exercise, especially resistance training, creates microscopic tears in your muscles. That's perfectly normal. It's how muscles rebuild and grow stronger. Yet these tiny injuries also cause temporary spikes in blood markers such as creatine kinase, CK, liver enzymes like ALT, and even lactate dehydrogenase, LDH. If you're being tested for liver function, heart problems, or muscle disorders, these elevations can mimic signs of disease, when in reality, your body is simply recovering from yesterday's workout. Studies published in the Journal of Clinical Pathology confirm that strenuous activity can lead to false positive results, complicating accurate diagnosis. And for older adults already dealing with chronic aches, fatigue, or conditions often misdiagnosed as inflammation or fibromyalgia, the confusion can lead to unnecessary stress or even treatments you don't need. So what's the safer choice? Stick to gentle walking, light stretching, yoga, or other low-intensity activities in the 24-48 hours leading up to your test. But hold off on weight training, long hikes, or any strenuous exertion, especially if your labs will include liver muscle or inflammatory markers. Part 5. Showing up anxious or flustered. Here's something you won't find written in any test instructions, yet it can completely change your results: your emotional state. Think about it. Have you ever rushed into a clinic out of breath, stressed about traffic, or nervous about the needle? In that moment, your body slips into a miniature fight or flight mode. Stress hormones like adrenaline and cortisol surge through your system. And what do those hormones do? They temporarily raise your blood sugar. They nudge your blood pressure higher. They can even alter your white blood cell count, affect thyroid markers, or make your heart rate jump. In fact, research published in Psychoneuroendocrinology shows that acute stress can distort lab results by changing glucose and cortisol readings in just minutes. I remember a patient who arrived late, flustered and worried. Her test that day showed abnormally high cortisol and elevated blood sugar. A week later, same test. But this time she came early, sat quietly, and breathed deeply. The results? Perfectly normal. Nothing in her diet or medication had changed, only her state of mind. So if you're investing the time and effort to get tested, do it right. Arrive early. Give yourself 10 to 15 minutes to sit quietly. Breathe deeply. Don't scroll through your phone reading alarming health headlines, those only fuel stress. Instead, let your body settle the same way you'd calibrate a scale before weighing. You want to measure your blood and body at baseline, not in panic mode. Number 6, not asking. Which tests require special preparation? Too often, women over 50 believe every blood test is the same roll up your sleeve, give a sample, and wait for the results. But here's the truth. Some tests demand very specific preparation, and skipping those steps can completely distort the outcome. Wouldn't it be frustrating to go through the trouble of testing only to get results that aren't reliable? Let's break it down with examples backed by medical guidelines. Fasting blood sugar and lipid panels. Fasting for 8 to 12 hours is essential. Skipping it can make your cholesterol or glucose appear higher than they really are. Thyroid hormone tests fasting isn't required, but timing matters. According to the American Thyroid Association, the most accurate readings come from blood drawn in the early morning. Iron studies best done in the morning and not immediately after taking an iron pill, which could falsely raise levels. Hormone levels, whether or not you're on hormone replacement therapy, HRT, can influence results, and your doctor needs to know. Cortisol or ACTH tests timing is everything. Cortisol naturally peaks between 7 and 9 a.m., so drawing blood outside that window may lead to misleading results. Parathyroid hormone and calcium should not be tested right after you've taken vitamin D or calcium supplements, as this can temporarily alter levels. The biggest mistake: assuming the lab automatically knows what's best. In reality, unless your physician provides clear instructions or you ask the right prep, might be missed. You could end up fasting when it wasn't needed, or worse, not fasting when it was critical. So before your next appointment, take one simple step: call your doctor's office or the lab and ask, do these tests require any special preparation? It only takes a minute, but it guarantees that your results truly reflect your health. And when it comes to your well-being, you deserve nothing less than accuracy. 7. Drinking alcohol the night before your test. I'm not here to judge anyone's evening routine. A glass of wine with dinner is common, and many of my patients enjoy that ritual. But if you've got a blood test scheduled the next morning, alcohol, even a small amount, is something you need to skip. Why? Because it can quietly disrupt your lab results in ways you may not expect. Even moderate drinking can raise triglyceride levels, temporarily boost liver enzymes like ALT, and dehydrate the body. If you're taking diabetes medications, alcohol can also lower your blood sugar and interfere with how your medicine is metabolized. Studies in the Journal of Clinical Laboratory Analysis confirm that alcohol within 24 hours of testing can cause misleading results, particularly in liver and metabolic screenings. Picture this. You enjoy 2 glasses of wine the night before. The next day, your liver enzymes come back elevated. Suddenly, you're sent for repeat labs ultrasounds and left worrying about conditions you may not even have. Worse, if you're being screened for metabolic syndrome, that one drink could make your blood sugar and lipid panel appear worse than they truly are. That's why my clear recommendation is simple. Avoid alcohol for at least 24 hours before a blood draw, 48 hours, if possible. It's a small sacrifice to ensure your results reflect your real health, not last night's indulgence. 8. Avoid tight sleeves or clothing that's hard to remove. You might think your outfit has nothing to do with a blood test, but it does more than you realize. During my years in clinics, I often watched patients struggle. Women in long-sleeved blouses with snug cuffs or cardigans layered over turtlenecks would wrestle just to bear an arm. Some even had to remove half their clothing in a cramped phlebotomy chair. Others rolled sleeves so tight they cut off circulation. This doesn't just cause embarrassment, it delays the process, heightens anxiety, and sometimes even limits which arm can be used. The phlebotomist needs clear access to the inner elbow, known medically as the antecubital fossa. Research confirms this is where veins are most reliable for a safe, successful draw. If access is blocked, it can mean multiple sticks, more pain, and unnecessary stress. The solution is simple: wear a loose short-sleeve shirt or a cardigan that opens in the front. Clothing that allows easy access to both arms ensures a smoother procedure, fewer complications, and quicker results. In healthcare, comfort isn't just about style, it directly impacts your experience. Number 9, not mentioning menopause or hormone therapy. This is one of the most overlooked details even by medical professionals. Your hormonal status can influence blood test results far more than most women realize, especially after 50. If you're postmenopausal or currently taking hormone replacement therapy (HRT), it's critical that both your doctor and the lab know. Why? Because estrogen therapy directly affects cholesterol. Studies show women on HRT often present with higher HDL, the so-called good cholesterol, and lower LDL. Without noting that you're on hormones, a doctor may assume your results are unusually good, or misinterpret your medication's effect, when in reality, it's the estrogen shifting the numbers. The same is true for hormone markers like FSH and LH. These levels can only be understood in context. Whether or not you're using hormone therapy changes the entire picture. Even thyroid tests can be influenced since estrogen alters how thyroid-binding proteins behave. I once saw a patient referred to an endocrinologist for abnormal estrogen results. Later, it turned out she was wearing a transdermal estrogen patch, and the lab had no idea. So always disclose: have you gone through menopause? Are you on HRT? Have you recently stopped? Do you use estrogen or progesterone in the form of patches, creams, or pills? Even if it feels minor, mention it. Blood work never stands alone. Context isn't just helpful, it's everything. Number 10, leaving right after the draw without checking. The needle's out, the vials are full, and you're ready to head home. But hold on. This is the moment when many critical mistakes slip through. Too often women walk away without double-checking a few essentials. Were the right tests actually drawn? Labs sometimes miss a tube or skip a test because of timing. Did they collect enough blood? Certain tests require precise volumes, and if the sample is short, it could be rejected, forcing you to come back. Was everything labeled correctly? It's uncommon, but a mislabeled vial can create serious mix-ups that delay or even compromise your care. And don't forget the follow-up. Do you know how you'll receive your results? Will your doctor call, or are you expected to check a portal? Should you schedule a return visit? These details matter especially for senior women. If you're prone to dizziness, fainting, or low blood pressure, don't just jump up and head out. Sit for a moment, sip some water, and let staff know if you feel lightheaded. I once saw an older woman rush off, only to stumble in the parking lot and end up in the ER, not because of the blood test itself, but because she stood too quickly on an empty stomach. The takeaway: slow down. Ask questions. Confirm every detail. A few extra minutes could save you hours of trouble and protect your health. As you can see, even the smallest details during a blood test can make a big difference to your health. Sometimes just one overlooked step is enough to cause inaccurate results or force you to return for another draw. That's why it's so important to take a few extra minutes, ask questions, double-check everything, and make sure you leave with clarity and confidence. Your health is priceless, and protecting it starts with these simple but powerful habits. If you found this video helpful, don't forget to hit the like button, subscribe, and turn on the notification bell so you never miss our next important health tips for life after 50.